Kidney stones can form due to various factors, including 1. Dehydration. Insufficient water intake can lead to concentrated urine, promoting crystal formation. 2. Diet. High intake of oxalate-rich foods, like spinach, nuts, sodium, and animal proteins can contribute. 3. Genetics. A family history of kidney stones increases the likelihood of developing them. 4. Medical conditions. Conditions like hyperparathyroidism, renal tubular acidosis, and cystinuria can predispose individuals to kidney stones. 5. Obesity. Excess body weight can alter urinary chemicals and increase stone formation risk. 6. Certain medications. Some medications can increase calcium or uric acid levels in the urine, promoting stone formation. 7. Urinary tract abnormalities. Structural issues in the urinary tract can hinder proper urine flow, leading to stone formation. 8. Inflammatory bowel disease. Conditions like Crohn's disease can increase calcium oxalate absorption, contributing to stone formation. 9. Metabolic factors. Imbalances in calcium, oxalate, uric acid, and other substances in the urine can lead to stone formation. 10. Lifestyle factors. Sedentary lifestyle, excessive alcohol consumption, and high stress levels can affect kidney function and increase stone formation risk.